Hi, my name is Sadie Harris, and today I'm going to be talking about why assisted suicide should be banned. First, I'm going to introduce you to a doctor to kind of help you understand what assisted suicide is. First, this is Dr. Charles, and he is faced with a problem that his patient has a terminally ill cancer. And this means that his patient will likely die, and there's no more treatments that he can furtherly do to help this patient. And now we think, what does this doctor do now that he can't do anything to better help the patient? You can make them more comfortable until they pass, or some doctors do recommend assisted suicide. And I think that assisted suicide is not the answer, and I'm going to give you 3 main points of why I think so. My 3 main points is it pressures dying people to end their lives. And when you give them this opportunity to say that you can kill yourself and we can help you, that pressures them and puts them in a really bad position. And it also turns doctors into killers. We know that doctors take an oath when they first, before they start practicing, that they will do no harm. And giving the patient a lethal drug will be doing harm. And these laws give society approval to kill. And honestly, when you think about assisted suicide, you also think about regular suicide. And if you are saying that assisted suicide is okay, then you're also saying suicide is okay, which most people do not think suicide is okay. We're going to talk about my first point. Assisted suicide pressures dying people to end their lives, believing that dying is their only way out of their illness. I looked up a study that was done in 2019 by Kathleen Cavey. She wrote an article for the United States Conference of Catholic Bishops stating that legalizing assisted suicide is a deadly mistake. And I also agree with that, because not only does it pressure the patient, but it also pressures the healthcare providers and not really trying to maximize what they know and trying to find something that actually could help them. They just jump to assisted suicide. My next point is assisted suicide turns doctors into killers. And like I said, assisted suicide is dying and ending a person's life way too early when it's not their time to go. And in 2015, Ryan Anderson wrote an article for the Heritage Foundation, and it says that physician-assisted suicide corrupts the practice of medicine. And their practice is to always care and never kill. And I also did another point of, in 2018, Jack and Need wrote an article on hospitalists with ethical practical impacts aid in dying laws, stated that physicians assisted suicide ask physicians to breach the broth of general duties, first do no harm. So we see that in all of these cases, it's bringing back why the oath that doctors takes in the beginning before they start their practice of doing no harm. And legalizing something like this would then be breaching that and doing harm. And another thing that doctors normally look at is funds. It reduces a lot of funds that is needed to keep a person alive, which would be regular testing, procedures, and hospital bed filling. So they could be more likely to resort to assisted suicide when these 3 things are a big impact. And assisted suicide laws give societal approving to kill. And assisted suicide gives approval to kill when thinking that that's the last option. And most people will tell you that it's a cost-saving thing, because when you are in the hospital for a long time, it does tend to cost money, and it is a lot, even when you'll eventually pass away. And they also say that in 2016, Krista Kafer wrote an article for the Federalist of how assisted suicide becomes a license to kill. And she made a good point in this article that death is cheaper than life. And I see how she would think that, and how caregivers and care providers would resort to that, because it is cheaper. But I do not think that that is the right way to go about it. But also in her article in 2019, Government agencies and private insurance companies also face incentives. Ending a patient's life is cheaper than providing care, because normally your insurance is what pays, and you also do too. So they just see this as a cheaper way to go about it. In conclusion, when you are dying, you are not the only one affected. Your family is affected, and everybody that is taking care of you, caregivers, care providers, everyone is affected. And assisted suicide also pressures dying people because they don't want to burden their family members, because they see how much of a toll this takes on them. And also, the doctor is the one that will end up giving the lethal drug, so it does make them go back on the oath of do no harm. And laws also give society approval to kill. Patients see that treatments will ultimately not work in their favor and prolonging their death date. They realize it's more cost-saving to die than to live. It's bad for the patient. It's definitely unethical for the doctor, and it also makes the decision terribly hard on the family. So, thank you.